The broadcast is now starting. All attendees are in listen-only mode.
So welcome everybody to OSHA Consultation Services for Small Businesses. And today's panelists are Tonia Cooper and Ocie Robinson. And Tonia Cooper works for the Arkansas Department of Labor in the OSHA Consultation Program as the Labor Inspector Supervisor for the Industrial Hygiene section. Now, the program provides Arkansas businesses with guidance on workplace safety and health requirements. And in this role, she coordinates consultation activities for the industrial hygiene section, schedules consultants training courses, provides training and support at statewide regional worker safety conferences, delivers training assistance to Arkansas industries and consultation staff, and periodically assists industries with obtaining OSHA outreach training. Now, prior to joining the Arkansas Department of Labor, she completed internships with the agency and the Arkansas Department of Environmental Quality. She's a graduate of the University of Arkansas at Little Rock and has a Bachelor of Science degree in Environmental Health Services. And she's completed technical courses sponsored by the American Industrial Hygiene Association, the OSHA Education Center at the University of Texas at Arlington, the OSHA Southwest Education Center at Texas A&M, University Engineering Extension Service, and the OSHA Training Institute of the U.S. Department of Labor. And we also want to welcome Ocie Robinson. Ocie has worked for the Arkansas Department of Labor for the past 9.5 years. He's been involved in the safety and health field for approximately 34 years in the private industry and state government. He has a Bachelor of Science degree in Community Health from the University of Central Arkansas. Currently, he supervises 4 safety consultants, provides interpretation of federal OSHA regulations, conducts informal and formal training on safety-related job activities, and answers questions regarding workplace safety and health requirements. Ocie has completed courses at the OSHA Training Institute, University of Texas at Arlington, and the OSHA Southwest Education Center at Texas A&M. And he also periodically provides outreach training for construction and general industry employees. Welcome, Tonia and Ocie. Take it away.
Good morning. Thank you.
Thank you so much. We just wanted to get started and have this opportunity to introduce our agency leadership, Leon Jones Jr., our director, and Ralph Hudson, our deputy director. And getting into the services that consultation provides, we wanted to kind of talk about that in general on cost of these services. Those services are prepaid with our tax dollars, so this is available to you to take advantage of these resources.
Our consultation program, we have targeted groups. We only provide services for private industry, okay? And within that private industry, we do general industry and construction. We do not do, we exclude public sector, which is basically our AOSH group takes care of those different entities, and those included would be such things as municipalities, cities, state, county government, schools, those kinds of entities out there.
Exactly. So that AOSH group, it stands for Arkansas Occupational Safety and Health. So the public sector getting assistance from our office would work with a different group, where the audience Ocie and I work with happens to be these targeted groups in the private sector.
And we also focus on the small employer. Definition of that is 250 employees or less per site within the state of Arkansas, or 500 within the United States company-wide falls under that definition of small employer. Also under that definition, we do assist the large employer but on a limited basis, and we can only do 10% large employer and 90% small employer are the groups that we focus on.
So to just kind of share with you about how consultation is the opportunity to work with these private sector groups in general industry and in construction with all these hundreds and hundreds of regulations that deal with workplace safety. So it's a great resource and benefit to have, say, a consultation group helping you look through all the rules and regs and kind of look at the ones you need to give most attention to and help you with those hazards and things like that. So we'll get into that in a little bit too.
There and again, it's already been mentioned previously, the types of visits. We do have a safety section As previously, we have 4 safety consultants that are trained, and I like to define safety as we look at those different issues out in your workplace that could cause physical harm, lacerations, cuts, bruises, broken bones, those type things, and that's usually immediate. And we focus on like your powered industrial trucks, electrical issues, those different types.
Yeah, so as far as getting in consultation with visits that you can request of us, these visits, we get to come when management invites us. We get to conduct these audits when you invite us to help you with those OSHA requirements. And the health side, with getting that help with OSHA rules, we look at health type hazards that maybe can impact our health in the long run and cause repercussions and problems in our body, and long term maybe even generate diseases or other types of ailments. So when it comes to health hazards, a lot of times we're spending time looking at chemical exposures, different types of air contaminants that people may be around, dust levels, or other types of products that you're using that could generate different contaminants, where OSHA regulates the levels of those things: lead, asbestos, hexavalent chromium. Some of the standards that have their own rule are some things that we may assist companies with. So when it comes to those health hazards, looking at what types of health hazards are in the workplace, we may focus on exposure to chemical levels and dust levels and other toxic compounds that may be in the workplace. We also focus on noise levels, because OSHA has some exact things dealing with noise requirements and how that can impact our hearing in the long run. Other areas we may give attention to may be things that have to do with ergonomics and those types of stressors that can lead to disorders in the body, and trying to help you with all types of things that are both safety and health to hopefully prevent you from having injuries or illnesses connected with workplace exposures. So the work that we get to do when we are conducting these visits, we get to come when the employer invites us, and we get to conduct how much help you are seeking. When we do those visits, we may do monitoring for the chemical exposures. So if there was a welding job, if there was a sandblasting job, if there was a spray painting job, any kinds of contaminants that have chemical exposures, the law wants individuals and employers to know what the levels are, what those respiratory hazards are, so that you can best protect your people from potential dangers and in the workplace. So the work that we're doing, you have to dictate the help you're wanting. Maybe you need safety and health. I'd like to recommend people getting safety and health visits at their organization periodically, so that we can look at all the safety type hazards and all the health hazards that are covered by OSHA. Not only do we just get a chance to work with you on what hazards there are, we get to do some other things that help you manage safety in the long run.
And of course, the scopes of our visits, we'll go ahead and continue in that, we can do comprehensive visits, which means that we're going to look at your written programs. We're also going to go out and look at your work environment, see if there's any improvements that can be made and to make those environments safer. And we can be here at the Arkansas Department of Labor contacted by telephone, and you're going to see our phone number at the end of this. You can email us or fax us for those requests. Also on our Arkansas Department website, you can actually request our services online, and the address to that, of course, is www.labor.arkansas.gov, and then from there you would go over to under topics on the right hand side of the page, and you'll see occupational safety and health private sector. Mm-hmm. And you would then click on that, and then it will have a lot of different information on that website that is very, very helpful to everyone. It'll initially show your amputation shutdown type information, your requests for consultation services that you can do online. You're going to see about, and we're going to talk about this later, our SHARP program, which is a special program that we have. Then you can also look at sample safety and health programs that you can actually fill in the blanks. We have our brochures on there, as well as teen safety. It has conferences, the different conferences, safety conferences that we'll also add additional information to on this site for the different locations throughout the state.
And, you know, Ocie, with the comprehensive type visit, like you described, looking at all types of hazards and all types of work environments, what about on the specific ones? What kind of details would we want to share about that?
Okay, on specific means that we will, on our visits, we will do specifically what you need. You may want us to come in and look at everything and assist you there. Or you may say, I've got some noise sampling I would like. Well, we can go in and do just specifics for you also. And then we can also do a follow-up, which means that if there are serious hazards identified, of course, part of our agreement with you for coming in is you will correct those within a certain time period. If you need additional time, of course, we have a form that you can fill out and request that. But the follow-up visit may be that you've had some serious hazards that you had to correct, and just to make sure that you've done those suitably, you may want us to come back, and we can also do that. Or there may be issues that you want us to come back in and assist you with even further, and we can come back in and do that. We do not handle complaints. We do get a lot of individuals throughout the state that call us with issues, and at that point we will assist those individuals to get federal OSHA, who is enforcement. We give them their phone number and give them advice on how they can report those issues.
Okay, and I know something that we may have not made clear in the beginning here with the consultation services that we provide. I just wanted to make sure we share that I mentioned how the employer gets to invite us, and we have to have an agreement to correct serious items if they're identified. So I wanted to bring that up. And usually with a serious item, like let's say we check for noise and there's a high level of noise and people were not wearing hearing protection, that could be a serious hazard when hearing protection may be mandated by the rule. So different types of hazards that we find, if they are considered serious, we have to have the employer's agreement to correct things that are serious. So we make that clear when we're taking that request on how our services work. Your tax dollars are paid for the services, no cost to you to get that help. So we may run tests for you, may do some monitoring for you, may do some follow-up visits and come and help verify things that you've improved on, and get all those resources that would normally cost many hundreds of dollars to cover on your own are covered by our tax dollars with the consultation program. So this free service that you know, is already prepaid, like we have mentioned, the employer gets to invite us and must be in agreement to correct serious items in a timely manner. So most people want to make sure they're keeping people safe from serious hazards, so that's a good thing. And I just wanted to kind of stress that. Not only do we just look at the hazards that are on the in the work environment that Ocie mentioned, we also try to look at how you manage safety. How do you have an overall safety program going? And we give some guidance and input on things that make for a good safety and health program to manage safety, whether you have someone coming in or not, that you have a good solid system that you're running to manage your safety. So that's a real big benefit that comes right in with the package.
And the final requirement is, and we'll make this very brief, is that our consultants are required by law to interview employees, and we have to have those prior agreements before we can initiate our visits.
Okay.
Let me find okay.
Okay, here we are. As far as the scope of that visit, like we mentioned, we have safety and health visits, and we have the comprehensive, the specific, and we have the follow-ups that we can do. The particulars of that visit can entail having an opening and closing conference. So going over the procedures and how our program works, and talking about the correction of serious hazards. If we have some serious hazards identified, like we're talking about here, different hazards can be classified in different ways. We talk about all the parameters of how that visit will work at the beginning, and then a summary type closing conference at the end. You want to talk about the other one?
We do a walkthrough of the workplace. And there and again, that walkthrough could be the complete workplace, or it may be just limited to certain areas. That is, of course, always according to that employer's request, okay? And that walkthrough, as I said, we have two different sections and focus on different potential hazards, and we're not only looking at workplace hazards, but we're looking at areas that could be improved. So it's not that we're just coming in to point out that there's something wrong. We can also we also do make suggestions as to maybe improvements that could be made, but it's always your choice.
Oh, and also with those hazards that are found, they could be identified and classified in a certain way: serious, other than serious, or imminent danger. So the serious hazards, like we said, we want to talk about deadlines and correction dates and things to get that and get some mutually agreed upon dates for that. And on other than serious, it would be ideal to correct all the things that are found, but it would not be a mandate if it was an other than serious one. And on imminent danger, something that is going to be immediately harmful, dangerous, or deadly, we know we would have to address that. So those are some categories that some hazards could fall in as we do this consultation work with these companies.
The focus of our surveys, we look at shop areas, we look at hazards, electrical hazards in your areas. We're going to do hazard communication, bloodborne pathogen programs, respiratory protection, and powered industrial trucks. Are just not all. That's not all inclusive. That is just kind of a general breakdown. We're going to look at your overhead hoist and your hoist systems and your cranes. We're going to look at the change cables. We're going to look for inspections. Are you doing your inspections as you should be? Those type. We're going to look at your hand tools, the different areas there.
And you know, these are some things that are listed here at the top with the electrical hazards, hazard communication ones, bloodborne, respiratory. We're seeing a lot of those particular kind of violations at a lot of the companies we work with. So it's definitely a good idea, even if you work with your safety program and have things in real good order. It doesn't hurt to get another set of eyes to look at some things, and we may be able to kind of further show some things that you may want to have improved upon that, or say, hey, these are things you're doing are really good, don't have any additional suggestions, but getting that extra input and getting this kind of a service is really a nice feather in your cap, because you have voluntarily called for our help and trying to do all you can to take care of your employees' well-being and follow all the rules that OSHA would have. So it's really a nice plus to the basket of helping you with your safety and health requirements.
Here,
Here we are.
Yeah, we're going to inspect your PPE, which is personal protective equipment. We're going to look for eye protection, hand protection, foot protection, your emergency facilities, your PFDs, personal flotation devices, etc. If you were to work on the river or by the river or whatever, and have access to it. Very important, machine guarding. That's one of those issues that's always brought up as a major factor in amputations. The guarding at the water edges, as we previously alluded to on PFDs, your material handling equipment. That falls under, of course, your ergonomics and your walking working surfaces to look and a lot of the walking working surfaces is housekeeping. We're going to take a look at your housekeeping. See also walking working surfaces has kind of come to the forefront because they've revised a lot of the fall protection in your ladders and walking working surfaces. That's one of those areas that has been updated by federal OSHA, and there's a lot of interest in that at this point.
That's come about just this last year or so.
That's correct. That's correct.
Some changes. And I know when Ocie was talking about the walking working surfaces and some new regulations that cover quite a few standards there with updates, we'll be able to try, hopefully guide you with the latest, greatest things going on when it comes to OSHA and providing safety on the job. And silica is another area that OSHA has some requirements for general industry and for construction that is a hot button item, because that standard is recent and with some new deadlines becoming effective lately for both industries. So our visits, we were just talking about some of the things we might cover and kinds of things we may be looking for. We also have a report that we need to be sent to our client within 20 days after that closing conference. So if those violations are found, serious hazard type abatement dates are going to be discussed and set, and recommendations on those types of things to correct what's found. So not only are we going to help you look at what violations were identified and hazards that we found, whether it's serious or other than serious, in that work that we did for you, you'll have documentation talking about ways to fix what was wrong and specific ways to correct what was a hazard that was identified. Sometimes when we're doing air monitoring for chemical exposures and things, we may have an additional closing conference with you once the air results are in. We have our dust samples, for example, collected and sent to our lab. And when those results come back, we are able to interpret those and give you a guidance on where you stand with the OSHA limits, whether you're above limits or below limits, and what other kinds of requirements the law would have you to know about those particular chemical hazards, which can be harmful to our health in the long run if we have high levels of exposures to contaminants above allowable limits. That's pretty serious because it can lead to diseases and other types of disorders that could impact our well-being in the long run. So that post-visit information, sending you what we found, what the classifications of the hazards are, what recommendations we make, and how do we go about correcting what's wrong is a big part of what we do.
I'd also like to add that confidentiality is strictly adhered to. You don't have to worry that if we go into your workplace, all of our services and the report and everything is strictly confidential between the Arkansas Department of Labor, OSHA Consultation Group, and you. As a matter of fact, we tell the employer this, that if federal OSHA, which is enforcement, if we do not report anything to them, not even that we have been into your facility. The report you do not have to show to federal OSHA if they were to be if they were to visit you, but that is your choice. We are not allowed to do so. So confidentiality is strictly maintained within our services, even as to whom we have made visits to, which companies.
Now, we have some special programs where recognition is given for having excellent safety system in place. And that program is called SHARP, which stands for Safety and Health Achievement Recognition Program. This program is administered here with the OSHA Consultation Program. So it has requirements where companies are recognized for having certain qualifications that they meet. Like, for instance, they have to be an industry that OSHA considers as high hazard. They have to have been in business like a year of operating history, have a single fixed work site, not employ more than, say, 250 workers at the site, and not more than 500 corporate-wide throughout the U.S. And then they would need to qualify and be eligible for SHARP, have a lost workday injury and illness type rates that are below national averages. So having a really good safety and health system is a big element in qualifying and becoming a SHARP site and being recognized for having some really good programs in place and a good way of managing safety at your organization. When people request to become SHARP, they actually will need to allow us to do full service comprehensive safety and health visits to accomplish and meeting that special program requirement. We would also look closely at how they manage safety, so that overall safety and health system that they have. We have some exact major elements and things to grade and score them on. That's a part of our safety and health program assessment type worksheet we use to look at various things that a good safety program needs to have in it. So we have a score of at least 2 on that particular worksheet that they are doing these various elements that constitute a really good system on managing safety. They have to agree to notify our office if there were changes to working conditions in their work processes, if they're a part of being on SHARP and those types of things. So correcting all the hazards that are found with those safety and health visits is another element to become a SHARP site. and you know, agreeing to have that good safety system in place and scoring really well to accomplish that. So that special program can kind of shine a light on you on having a really exceptionally above the average type safety program at your organization. So it's something to be proud of, to have a banner. That one on the bottom right is the type of banner that sharp companies will have throughout our state that have made that accomplish that goal.
And they will also receive a flag. Some of the additional benefits of being a sharp is that whenever you become sharp, as far as whenever federal OSHA may have what's known as programmed or planned visits, you will be exempt from those for that period in which you are sharp. When you initially go into the sharp program, the renewal is 1 year, and then after that it's normally 2 years. And during those time periods, federal OSHA is contacted and notified that you are on the sharp program. Therefore, you are exempt for those type of visits from them.
Thank you so much, Ocie. That's a very important element of the SHARP program. As far as other assistance that we provide, off-site assistance, often we stay busy with trying to answer those questions that people have on different OSHA requirements and other interpretations of standards to understand how to apply it to their workplace, or a question has arose and they want to find out what is OSHA stand on this and what's the correct answer to that. So we spend time, our consultants spend a lot of time assisting companies all the time and being there, say, like personal consultant, like we part of being consultation. So that helping them with the things that they need help in, with the expertise that we have to help with those rules, is something we definitely are happy to be able to do. And a lot of times we may have to research those questions, and they're not always a standard type answer for them, and it may take several things to do to get that answer, but we take pride in trying to do that and give you the best service that we can. So not only can we do business on site and help you and talk with your employees and look at your work environment and help you with your safety system and make sure your programs are meeting the requirements, we can also be your go-to to help you with some particular questions that have arose, to help you with all these thousands of rules that would take to cover those safety and health efforts. On-site assistance, Ocie, you want to talk a little bit about that?
Yes, we're going to provide some guidance on your safety and health programs. There and again, that is all up to the company representatives that invite us in. We're going to look at your programs. There are certain written programs that are required that you maintain by law. And I previously mentioned that we don't just come in and say, you need this written program, figure it out. We're going to put you on our website. We're going to go into our programs. Those are for your use. It was the taxpayers' money that those created those, and so you can actually take those, bring them into your computers, and fill in the blanks and modify those to suit your needs according to your work requirements. We're going to give you guidance on the OSHA standards and guidelines. We mentioned previously that the laws have been updated recently, and so that always creates a lot of interest from the employers and employees within the state as to what are those changes and what does that mean to the individuals and the work site as far as maintaining a safe work environment for everyone.
Yeah, and I know sometimes you are able to help companies by conducting a little training class or special kind of requests that we sometimes get on certain standards that they want more help. So we do have a chance to go to their location sometime and make a presentation on certain requirements that they would like to have more input for their workers or their managers, or all together, both.
Absolutely. Several different types of training, like we just stated. Formal means it's a classroom, and classroom we bring in certain presentations. We do that on site and sometimes off site. We do it in a lot of different formats, and the reason we do that is simply because we'd like to get as many different companies, representatives from different companies together at one time as possible, to where they can bring that information back and provide that to their employees. We do informal on site from time to time, and our consultants do an awful lot of training on site, the informal type, which means we just explain the different programs. We explain why a hazard is a hazard, and we also try to explain different means of that you could potentially address those hazards. We also have the regional safety conferences. There and again, on the Arkansas Department of Labor website, we have brochures for these different conferences that we have, the dates, times, locations throughout the state. Again, these are set up, and they're there to focus on the worker themselves. Therefore, we always want the safety professionals and the supervisors and their supervisors in attendance, but we also focus on the hourly employee themselves, and we ask that you also have those individuals attend these conferences with you.
I think it's been real successful with those conferences like that. So it's a unique type of approach, because it's not just for management. It is designed so that hourly benefit and focusing on companies helping keep their safety teams and safety committees informed and educated. And with them being regional and happening in various regions of the state throughout the year, there's about 10 or so. And on our website, you'll be able to see the different towns and go to one in coming to your area. But that unique element that it has gets that training to those safety representatives and individuals that may help you that are hourly, as well as get that message spread throughout the workforce for rank and file to understand why safety is so important. This is really a benefit to say maybe stop and prevent some of the injuries and illnesses that happen throughout the workplace, and make a big difference on keeping those organizations even safer and steadily improving. So these have been really well attended over the years, and there's a lot of details on our website to share with you, and you can even register online for these regional conferences. The first one that's coming up will be here in the Little Rock, Jacksonville area in March. So that's right around the corner. So that brochure is actually on our site, and online registration can be done for that. And the other parts of the state will follow throughout the year. So be sure to take advantage of that, because it is definitely a good day of training when you attend those meetings.
And understand the subject matters of these safety conferences is coordinated throughout representatives throughout the state. We have first part of December, we have a meeting and make a determination of what locations and then what subjects should be covered. And this is done within a group of the safety professionals, and representatives from all over the state will come in to help us make those determinations. So it's a group effort.
As far as training programs, like we were saying, sometimes coming to your site to talk on various OSHA topics, that opportunity can come with special requests for things that companies may need and can benefit from. So submitting that, and we get those requests, and our manager will determine which assignments on helping with these training opportunities. So these are some areas that would definitely be some things to consider if you needed additional help with training and understanding what the laws have you to know about it, so that you can then do the training you need for your workers, or help you educate your workers as you do those steps to complete your training. So these training programs will assist you with the requirements in some of these areas. Machine guarding, OSHA record keeping, the hazard communication requirements, anything that we can do to help you with various rules to help you accomplish what the standards are asking you to do, we want to do it. Forklift and noise, we've talked a bit about on some of those things when we were talking about hazards in the workplace. And air contaminants, there's thousands of different ones regulated, and limits that are set by OSHA. So we want to help you in every way we can with understanding certain standards that have certain training requirements that you would need to address. Ergonomics, and then general hazard recognition. Just knowledge of hazards for your workers and yourself is a big benefit to help you with meeting OSHA requirements. The general recognition is a lot of things that is discussed in those conferences, I noticed too over the years. OSHA outreach training can be looked at on a limited basis, so we try to assist with that if we can. Other regional training available, like we mentioned earlier, in various locations throughout the state, where we were just talking about that on that prior slide.
And also on the regional training, a lot of times we will focus on what we call the special emphasis programs, such as amputation, the grain industry, different subject matters where groups get together within those industries, and we can do training. Therefore, the training provides a lot of information for a lot of different companies at one time.
Right, and you know, those conferences, those regional training conferences offer a chance to get some updates on what OSHA's looking at right now. And you said those emphasis areas that they're paying close attention to. And I noticed with enforcement, they spend a lot of time in construction, and also in various particular areas that they have emphasis on to try to prevent, like you said, amputations and machine guarding, and those things tie together. And when we do that training, Ocie mentioned our website too. There's an amputation stand down type information on our website that ties into a special emphasis area on preventing amputations, because that's something that's running kind of prominent in our states with those events. On those amputation prevention type booklets, there was an effort to make a difference, because quite a number of amputations had been occurring in our region and in our state, and our leadership and the federal office and companies and interested employers got together to look at what we could do that might help prevent amputations. So that group worked on some efforts to create some resources to help companies throughout the state, public and private sector, to prevent amputations because of how debilitating and life-changing an amputation can be, and wanted to make a change. So our office and the federal office and the employers throughout the state that participated helped pull together some literature to get some booklets for various areas to help prevent amputations. So these booklets were put together by the industry people that work in those particular industries, and some of the booklets we have were for, say, sawmills, for metal fabrication groups. There were some for general industries, some for public sector. There were some for some other types of areas that OSHA put a lot of attention on, with amputations being prominent and likely to try to prevent those. So the literature we have on that is available to get those booklets to you when we request it. There was also a video with that effort on coming up with what we can do in Arkansas to make a big difference, and a company helped pull together a video that is very useful and put together really well. I like it. It's dealing with preventing amputations that would be a part of some efforts you can do. And so our office had an opportunity to be a part of an amputation stand down, and we were fortunate to also be recognized for that work on that amputation stand down, for the first one in the entire country to ever do something that focused on amputation. So we're now in the second, maybe third year, and that was something that had not been done. And when it comes to a stand down, can you tell them a little bit about what a stand down would be if they were dealing with amputation prevention stand down?
Well, what we ask the company to do during the stand down is to stop their work for a certain period of time and discuss specifics as to those potential hazards that could create amputations. Just basically focus on the prevention of amputation through lockout, tagout procedures, proper machine guarding, hazard identification and correction on those different areas within their facilities that has the potential that could cause a serious injury such as an amputation. Some of the other emphasis programs that we've dealt with and do have booklets on as temporary workers, and it is well known that temporary worker needs to have the same training as the employees that are long-term and be able to do their jobs safely. You have your day laborer who really, quite frankly, at times they're just brought out there given limited information as far as what those potential hazards could be. And then, of course, you got your team workers that a lot of times it's just not known what certain jobs that they're able to do, the hours that they can work, and what it takes in order for them to work safely also. Okay, we also have a media centers. We have one here at the Arkansas Department of Labor in Little Rock, and then we have one in Paragould. We provide training DVDs. We have information and publications upon request. And on the DVDs, we have, and I'm not for sure just how many, but many. And on those DVDs, of course, you request. You can go online at the Arkansas Department of Labor as well and request those electronically. And you fill out the information. You get it to Alicia Evans, or you can call her at 501-682-4528. And then here, Alicia's email address. You can email her. And those DVDs will be sent to you. The only requirement is that you return those so someone else is able to also view them.
You know, that library, the media center with the DVDs is real helpful, because that way you can have access to various videos that help you with your safety training. And quite often people will call in and maybe even come by and pick up one that they may use. I know sometimes if I got a training event and want to use a video, I'll go and pick one that I believe will be helpful with the group I have. And we see a lot of safety and health managers using that library of DVDs to actually introduce their employees to various topics and help them with the training that they're doing regularly through the year. And that way, that's a resource you don't have to expend money on, that's utilizing this at no cost to you for the videos that are available for you.
Safety awards?
Okay. Also, with some of the services our safety division has, individuals could qualify for the safety awards program and qualify for a cumulative year awards or a million work hour type award. And the particular applications to apply for that are on our website. And the contact name here is Nita Matlock at 682-9092, and there's her email for you. And like I said, on our website, which was www.labor.arkansas.gov, information on that award and those specific ones that you may qualify. And often companies may even decide they want to have a ceremony and have that award presented on a particular day when they have achieved and reached some of those milestones. So that's information we definitely wanted to make people aware of that not always individuals know about. As far as our contact information, here it is at our agency over here on 10421 West Markham. That's where that Little Rock Media Center DVD library is located as well, that we were speaking of. Our website, again, is on here for your use, fax number, and those things. My phone number there for any industrial hygiene type questions with OSHA requirements and any safety requirements for OSHA. Ocie will be happy to work with you, and there's his number.
My number is 501-682-4516. And as we mentioned previously, we not only will assign consultants to perform services upon request, but we also do answer a lot of the different questions about federal law, the federal OSHA standards, as well as interpretations, and provide that type of assistance for you.
And you know, we were talking about SHARP and that special program, and there's an organization called Arkansas SHARP VPP Association that regularly meets with people interested in SHARP and VPP, as well as just safety and health issues, and want to be a part of that. And that's another organization that we can give you information to contact the facilitator and be a part of that organization. So that's something unique as well. It's called the Arkansas Sharp VPP Association, and that's a group of employers and interested individuals that focus on safety and health type requirements and mentor each other and tell each other more about things that are going on with safety and health throughout the state.
And I also like to mention that we have, even though we don't have a slide of it, we do have an organization here that's called VPP Sharp, and that organization meets usually every third Friday of the month. You do not have to be a Sharp or VPP, which is a voluntary protection, which is a federal OSHA type special program, to come to these meetings. And we do have a lot of very good information, presentations, and you have a lot of safety professionals as well as employees from safety committees, etc., that do come to this meeting, and a lot of good information is quite frankly shared with one another.
Okay, I think we've gotten to there. Tim, would you like to pick up now?
All right, thank you very much. Good job there, Tonia and Ocie. And just want to remind everybody that today's webinar is being brought to you by the Arkansas Small Business and Technology Development Center, specifically our office that's located on the campus of the Arkansas Tech University in Russellville. So thank you to Rhonda and the crew up in Russellville that brought this to us today. So as we mentioned at the beginning, we do have time for some brief questions and answers. We didn't have any technical questions while this is going on. I did answer one question from an attendee who had to leave early, asking if this was being recorded and could he get a copy of it. And as we mentioned at the very beginning, we did record today's session. It'll take me an hour or two to get it up on YouTube and ready to go out, but everybody will receive a follow-up email, and in the email we'll include a link to the video as well as a copy of a handout with the slides. So if you have any questions, down at the very bottom of your control panel, there's a little box that says question/chat. You can fill that out and submit us a question, and we'll ask our panelists while they're on the line to answer any questions that you might have about what we've talked about. And we do have a question that popped up here asking, is there a certain size business that needs to comply with federal OSHA regulations?
Okay, if you have one employee in your private business, you follow OSHA's rules. So the OSHA doesn't say enforce rules on the owner, but if you have one employee, it applies, or if you have 10,000, it applies. So there are some standards that talk about, one standard I can think of that talks about size, and it has to do with record keeping. When you're 10 or fewer, a certain form doesn't have to be kept. But otherwise, if you have one worker, OSHA laws apply.
Now you said one worker. How about if it's a sole proprietorship or like a husband and wife that run a food truck?
Right. If it's only the owners, OSHA typically is not going to cite the employer. They would hold them accountable for their workers.
You have to establish with federal OSHA, you have to establish a employer-employee relationship.
So if it's only the owners alone, OSHA would not enforce it on the employer.
Or a family type company that only family is doing the work, then they do not fall within the federal OSHA laws.
All righty, good answer there. Any other questions that anybody might have? While we're waiting, I do want to thank everybody for attending. I want to let you know you're invited to our next webinar. The next one of our small business series of webinars is going to be Small Business Marketing 101. That's going to be on Tuesday, February 6th at the same time, 10 a.m. Central Standard Time. And I'll put a link with the registration details in the outgoing email. So you'll get the opportunity in the email that you get after this to click on a link and sign up for that if that's something you would like to do. Well, Tonia and Ocie, you're not being bombarded with questions today, so it means you must have did a really good job in your presentation. So looks like we're all going to be done. So I do want to thank everybody again for showing up today. For the attendees, if you're like, how do I get out of this panel? I've never seen this before. In the upper left-hand corner, you'll see where it says File. You can click on File, and then down there at the bottom, you'll see Exit and Leave, and that will put you out of the webinar. And I'd ask our panelists to remain on the line for just a few moments more so we can have a quick conference call. And thank you again, everybody, for attending.
I would just like to add, do give us a call or fill out a form and send those requests to us. This is a service that's provided for you, and we are here to assist you.
All right. Thank you, everybody.
Thank you.
All right. Stand by, everybody. We have open microphones here. And Nathan, I'm not going to kick you out since you're the sponsoring organization. But good job, everybody.